besides the suspected patient from Datuk cluster, do you think it's adequate for now to just test other suspected patients?
So what we are doing now is to increase the capacity of our lab. So our lab, we started with testing, the total testing test per day is about 3,500. Now we have increased the capacity to about 7,000 a day. So we have actually increased the capacity further to test, perhaps by end of this month, we should be able to test 16,000 cases. Now, if we look into, once we have this capacity to test, and we are also testing a few antigen, rapid test kit antigen. So we want to use the test. That means if we can test more people, asymptomatic, and if it's positive, then we will isolate them, and then we will treat them. So once we have a lockdown ataupun MCO in place, then we continue to look into the target group. So we will have a target approach. For example, certain group that we think there's high risk, then we will target them. And if we can pick them up early, that will be much better. And then we will isolate them and we'll treat them. So that is our, our plan in terms of to use this test. Now, if we learn from the Korean experience, they do about 20,000 tests a day. So we are not that far. We are doing about 16,500 in next one or 2 weeks time. So we will continue to test more people, and hopefully we'll be able to detect more. And by detecting more and taking the infected patient out of the society or the community, then we may flatten the curve. Flatten the curve means that our capacity of a hospital, we are really enhancing our hospital and able to treat the patient well. So you can see today that we have 64 patients managed in the ICU. And out of the 64 patients, we have 27 patients, if I'm not mistaken, 27 patients already on a ventilator. And if we treat them well, and then they can actually recover in time. The only worry is that when there's a surge, exponential spike, and the capacity is limited, then we have to choose which patient will have the privilege of ventilation. So we hope that we do not come to that stage to decide which patient can have ventilation and which patient cannot have ventilation.